The spine is composed of a lot of different elements. There's vertebrae, which are kind of the blocks which allow the spine to have strength.
It's a column of bones that stabilizes the body. This is what sort of serves as the foundational structure that the spine is built on.
In between each of those vertebrae are discs, and the discs act as shock absorbers.
Then at each level of the spine, there's the spinal cord running through and an exiting nerve, which is like the exit ramp of a highway.
Our brain relays messages through our spine, and our spine acts as a conduit to relay those messages to different parts of our body, allowing us to function, such as giving us the ability to move our arms or legs.
You can have injuries which are due to the disc, the shock absorber wearing out, injuries due to the bones being arthritic and overgrown. You can have problems because of a fracture, an infection, a tumor.
Anatomical issues could be of concern as well. So if you have something like scoliosis, where your spine is bending in different ways than normal, it may cause stressors in different areas. But even just normal degeneration of the spine can cause issues down the road.
We always try to start with the non-surgical management first because surgery is obviously a big step for anyone to take and a very permanent step.
When we talk about pain, especially in the spine, the importance is not just treating the pain. The importance is in treating the patient as a whole. We do have physical therapy in-house that can work with you on your core strengthening and various exercises to improve your general well-being and your pain.
We use medications, and there are a variety of medications we use depending on the patient's symptoms. Sometimes if the pain is really overbearing, or if they've tried physical therapy and tried exercise and they're still having a difficult time, then we'll utilize injections to provide medication locally to the source of the pain.
Beyond that, we do more advanced procedures, things like spinal cord stimulation, peripheral nerve stimulation, and even minimally invasive direct and indirect lumbar decompression.
There are a variety of different treatments that we have. One is surgeries where we're just creating space for a nerve and not putting any hardware in somebody's spine. The bigger surgeries are when we're either doing a fusion or a disc replacement. And in those situations, we're putting hardware into somebody's cervical spine or lumbar spine. We're fortunate to be blessed with a lot of great technologies for all these surgeries. Any surgery done at spinal cord level, we use neuromonitoring. That gives us real-time feedback as to how the spinal cord is tolerating the surgery. From an imaging standpoint, we have a CT scan machine we use during the surgery to make sure all the screws we're putting in are safely in the correct corridors and not compressing any nerves. That really minimizes the risk of a nerve injury. We have a robot where you can pre-program the robot to put the screws in the right places. And then we do have some special minimally invasive surgical tools at Yale as well, which is endoscopy. Endoscopy is using small camera portholes to do trimming of the disc, discectomy surgeries, and shaving bone surgeries, laminectomies.
You have many clinicians of diverse skill sets all working together to optimize best case scenario outcomes for patients dealing with spine conditions.
We have spine surgeons available, both from neurosurgery and orthopedic surgery. We have physiatrists that work alongside us, as well as physical therapists.
Every day in our clinics, we see patients that come in to see us because they've been dealing with pain or that really limits their ability to function, live the lives that they want to live. And it's very rewarding to, number one, talk a patient through that, provide them options, connect them with the right resources, and try and help them maximize their improvement for the best outcome scenarios.